Being a chartered manager means that you are a specialist in that area, and it means you've got all the skills to do the job to the best of its ability.
You are seen as a leader, a true leader who has credentials behind the great work you've already been doing.
It's enhanced my understanding, it's enhanced my skill set, it's improved my mindset.
It makes all the difference.
This session is recorded and will be available on the CMI website and YouTube channel. Join the conversation by using the live chat box for your questions and comments. We'll answer as many as we can during the Q&A.
Good afternoon, everyone, and welcome to the Why Intersectionality Matters in DEI Strategy digital event. My name is Mary Bolawale, and I'm an event delivery coordinator at CMI. Don't forget to join the conversation by using the live chat box, and feel free to ask any questions you have for the speakers, and we'll answer as many as possible during the Q&A session. I'll now hand over to Kenneth, the Diversity and Inclusion Lead of the CMI Scotland Regional Board, to begin today's event.
Thank you, Mary. Hi, everyone. Good afternoon, and welcome to today's session on why intersectionality matters in DEI strategy. My name is Kenneth Uka, and I'm the Diversity and Inclusion Lead for the CMI Scotland Regional Board. Today, we're going to be speaking about intersectionality and why it matters in DEI strategy. By day, I work as a strategy planning officer in higher education, but intersectionality is not just a professional interest for me, but it's also deeply personal. About 3 years ago, I moved to Scotland, and as a young Black professional working in Scotland, I experienced the reality of intersecting identities every day. And I understand firsthand how these multiple identities can not just shape how you experience the workplace, but how you're perceived and how, it shapes the kind of opportunities you're offered and the barriers that you face in general. And this applies to, everyone in this session. If you pause for a moment to kind of like reflect on your own story and see how your context, history, and identity sets you and your experience apart from the next person beside you, you see why intersectionality is important and why we should be talking about it. It gives language to the complexity that we carry as people, and also gives insights to how organizations should be shaping designing their cultures and strategy in order to recognize the differences that people carry rather than smooth them away. Without taking too much of our time, today we'll be hearing from two amazing speakers, Professor Kate Sang and from Paul Wilden. And the intention is to get us to move away from performative diversity and surface level initiatives. And over the next 1 hour, we'll hear from these amazing speakers, and hopefully at the end of the session, we all would have, gotten 1 or 2 insights on how we can, play our part in order to move this course forward. Today, I'll just ask that everyone stays engaged, try and, put your thoughts in the chat. If you've got any questions, just keep them noted, because we're going to have a Q&A session at the end of today, and then we'll go over these questions and we get everyone to speak on it. I would like to introduce our first speaker, Paul. Thank you, Paul, for making time to be here. Paul is a senior advisor at Warburg Pincus, and he's also a chartered companion of the CMI. Currently serves on the board of Companions, and today Paul will be bringing his own exceptional, experiences. We're talking about it from his global perspective, being a, having handled senior roles across continents. And what really makes Paul's perspective very valuable today is his understanding of how context actually matters. You can be the same person with the same experience, and still face different levels of inclusion, privilege, and marginalization, depending on where you are and who you're with. And Paul will speak to these realities. So please join me in welcoming Paul Wilden. Thank you.
Thanks very much, Kenneth, and good afternoon, everybody. I wanted to start by doing a little bit of kind of a scene set, which is less about my my professional career, but it starts with kind of my personal kind of lived experience, and I think that's important in terms of a little bit of scene setting, so that I can kind of move into the context that Kenneth had just referenced. So when I was born with a condition called microceratresia, which is Greek for little ear. So I'm missing my right ear and I'm profoundly deaf on my right side. As a child, my parents were told that I would struggle in the classroom and would not be academically successful because I would miss too much. Equally, because of my disability, I was singled out for elements of sort of different treatment, if you like, and one of these experiences was being sent on something called the HCPT, the Handicapped Children's Pilgrimage Trust, which is where kids with different types of disability were sent to Lourdes in the south of France, in the hope they might be cured, which I know sounds ridiculous in the 21st century. And I remember from that experience being on the train going through France and looking at these seriously ill children, some end of life, and some severely disabled, and looking at them thinking, oh, is that going to happen to me? Is this the journey that I'm on? So it had a very kind of profound impact on me. And I wanted to kind of reference both what my parents were told in terms of not being academically successful, and what I then experienced in terms of being sent on this trip to Lourdes as kind of key elements to what has made me who I am today, the person I am today. As a result of those kind of childhood experiences, an awful lot of surgery as well. The cartilage from my rib cage has been moved to the side of my head to try and make me something that looks like an ear, and being bullied at school because of my ear as well. All of those experiences, which as a child were hard for me to process, are aspects of who I am today that I try to leverage in a more positive way. So I've tried to take those negative experiences and then pivot them into being some things that I can use in a very kind of positive way. Moving forward a little bit, in my early 20s, I decided I wanted to go and travel around the world. So I spent 18 months backpacking around the world, and I had two things that I wanted to try and deal with during my time overseas. One was my ear, in terms of trying to understand a bit more about what caused the condition and what I could do about it as well. And equally, what I call an AOC, an act of courage, finding the courage to actually cut my hair short above my ears and put my ear on display. And the second aspect of my identity I wanted to deal with was my sexuality. I am now married to a man, but part of my upbringing within the Catholic Church meant that that was something that I found very difficult to reconcile and accept. So the intersectionality aspect of Paul is really started with the combination of trying to process and deal with and accept my ear and put that on display to the world, and then deal with who I was in terms of my sort of sexuality as well. I'm pleased to say that by the time I came back from traveling around the world, I had dealt with my ear, but I had not dealt with my sexuality. So that then became something that I didn't quite beat myself up over, but I then wanted to try and address, and I did. If I move forward a little bit, that experience of of traveling and living in different countries, I found really appealing, and I wanted to try and find a way to factor that into my professional life. So as I sort of settled into work and joined various kind of global institutions, I had a strategy of my own, which was to try and position myself to live and work overseas and ultimately try and secure a global role. And I took the view that how could I ever be considered for a global role if I'd only ever lived and worked in one country? So that was my logic in terms of my backstory and my focus in terms of trying to kind of secure a global appointment. That then kind of resulted in me back in 2005 being given the opportunity to move to Singapore, which I embraced immediately. Now, at the time, and from the outside looking in, as someone that had only been to Singapore once, I didn't really understand the dynamics of truly living and working in Singapore. At the time, being gay was not something that was going to be easily or readily accepted in a Singapore context. So I made the decision that I was going to compromise my personal identity in order to move forward with my professional career. So it was a conscious decision to put one aspect of my identity ahead of the other. And what that then translated into is that when I rocked up in Singapore, and as I then traveled around the region, there was a part of who I was that I kept off the table. It was not up for discussion. It wasn't something that I shared. And that then created a level of, I think, distance between me and my colleagues, in that I didn't bring my whole self to work. I brought part of me to work. Now, over time, and as I got more comfortable with my colleagues, I started thinking about taking more risks around that other aspect of my identity and disclosing more about me. But it was a journey that I went on in context of my own confidence in who I was, but equally wanting to get reactions from other people. Now, I kind of described all of this as an AOC, an act of courage. So finding the courage to share more about who I am as an individual. And my view today is that by sharing this information, I help to raise awareness. I make it easier for others. So I do it for kind of selfish and for selfless reasons. Selfish because at a level it continues to help me in terms of my own journey, but selfless, and that if I can demonstrate that it's not held me back, then hopefully that will be helpful to other people. Now, when I try and lean into the aspect of intersectionality about my own journey, what I often found was that sometimes I would lead with one and sometimes I would lead with the other. So living and working in Asia, it was often much easier for me to lead with disability than it was to lead with being gay. But over time, I found a way of being able to kind of weave the two together. I think that the other aspect of living and working in Asia was that not only was my disability and being gay part of my intersectionality, but so was being Caucasian living in Asia. So I often found myself in a situation that I was the minority in the room, not for one reason or two reasons, but for three reasons. And that was something that, again, I had to kind of embrace and get my head around. From a kind of D&I perspective, at one point I felt like I was the perfect employee because I ticked so many boxes and could kind of, kill all of these birds with one stone by just kind of bringing my whole self to work. But what's also to remember in the context of talking about all of these things, these acts of courage, is it can be often exhausting talking about these things. So I think when you're in a work environment and you're talking with your colleagues, I think you have to be sensitive to and willing to allow them to talk about what they want to talk about when they're ready to talk about it. You can't force the issue, nor should you. And there's a phrase that someone who I hold in very high esteem often uses, which is accepting without understanding. And it's not a problem to solve, it's a reality to embrace. And I think those two expressions are really important in terms of creating kind of an inclusive workplace where intersectionality is part of that kind of DE&I sort of story. Some examples that I wanted to share that have had an impact on me, both negative and positive, it include the element of open plan offices. And what I mean by that is that I'm profoundly deaf on my right side. An open plan office can create challenges for me in terms of being able to kind of hear what's going on and contribute and be involved. That then sort of translates into reasonable adjustments. But what is a reasonable adjustment, and how comfortable was I asking for that reasonable adjustment? Yes, I asked, but I did it in a way that didn't put the spotlight on me. I wanted to be low key about it. So what that meant for me is that, imagine a bank of desks on a trading floor. I wanted to be the far right hand end of that bank of desks, so there was nobody on my right, so that I could then hear all of the conversations on my left. Equally, when everybody was asked to move to headsets that they then would plug in when hot desking became a way of working. Well, that didn't really work for me because I couldn't wear the headset, and I really needed to have a old-fashioned phone with a handset, which I got, and it meant that I then had to have a fixed desk. But it then also drew questions from people in the team, like, well, why has he got that? Why can't I have the same? I want the same. So there were all these kind of things that were kind of coming into play. Overarching all of that was a cultural dynamic that needed to be sort of factored in by me as well. I was an expat living in a foreign land, and I needed to be very culturally aware of how I reacted to and dealt with some of these sort of situations and challenges. And I kind of used the logic that I'm a guest in the country. I need to show a lot of respect to the people I'm working with, and be considered in how I kind of react. One of the expressions I've heard recently, which I really like in the context of individuals with disability, and I think this then cuts across intersectionality as well, is a phrase that's used within the UAE, and that is people of determination. And that's about emphasizing empowerment and strength and shifting the focus from the negative to the positive. And I think that's a really, really lovely expression to use in the context of D&I in its broader sense. It really is about people of determination, because you're determined that what is intersectional about you is going to be a positive that's going to create opportunity, and not a negative that's going to hold you back. So in terms of just kind of wrapping up this element of the session, some things I'd like to kind of leave you with is listen, digest, act. Think about the impact of what you ask and what you say. And if you've learned anything from what I've just been talking about in terms of some of my experiences, everybody is on a journey, an individual journey, and intersectionality will be playing a part of everybody's experience in a different ways. So don't assume, be respectful, considered, and create an open, safe environment where people feel comfortable to kind of bring their whole selves to work. And with that, I'll hand back to Kenneth.
Thank you so much, Paul, for sharing such valuable perspectives. To be honest, it got me thinking about my own, context as well. And, I was just thinking about it and how, as people, we all have our own different, experiences. And just like you said, Paul, I think it's really important that, as an individual, I hold on to my unique differences and hold on to it as something to be proud about and not something to shy away from. And I'll just resound what you just said, which is don't assume, don't think you should not be respectful about other people's experiences and context as leaders, and try to create a safe space, which is actually what we're talking about today. With that, we'll move to our next speaker, Professor Kate Sang. I'm delighted to welcome you. Kate is director of the Center for Transformation of Work at Edinburgh Business School, Heriot-Watt University. Kate's research has been central to actually understanding how organizational systems can either reinforce or dismantle inequality, especially for people navigating intersecting identities. And today she'll be sharing insights from her studies on workplace experience and the organizational levers that move inclusion from aspiration to impact. Please join me in welcoming Kate. Thank you.
Thanks very much, Kenneth. So Mary's going to drive my slides for me. I don't have too many slides for you. What I want to talk to you about today is where we come from in terms of thinking about intersectionality at the Centre for Transformation of Work, and some research evidence around how particularly disability and gender can intersect in the workplace. So it follows on pretty well from Paul's talk. So if we can move on to the first slide, please. So what I'm going to start off with is talking to you about, when we say intersectionality, what do we mean? Because it's a term that I think gets used quite a bit, and there are different meanings and different perspectives on the term. Then also look at, why does intersectionality matter? So what does the research evidence tell us about the importance of taking an intersectional perspective in the workplace? And then think about, how can we be intersectional? So what kind of changes can we make in the workplace to ensure that our initiatives are intersectional? So if we can move on to the next slide, please. So intersectionality is a term that has moved from academic research into kind of more popular usage, and it's one of the most successful academic terms, I think, intersectionality. And it has multiple ways that it's used. So Kenneth referred to intersecting identities. The term was originated by Kimberly Crenshaw, who's a law scholar from the United States. And Crenshaw particularly focused on the experiences of Black women in the United States. And what she was focusing on is intersecting oppressions. So rather than looking at the intersections of gender and race, Crenshaw argued that we should look at the intersections of racism and sexism. So Crenshaw's work was really trying to understand, what are the experiences of Black women in the workplace? They can't be solely explained through racism, and they can't be solely explained through sexism. And intersectionality is not additive, so it's not an equation. We can't say that if we add the experiences of sexism to the experiences of racism, we'll come up with a number that helps us to define intersectionality. It's a more qualitative approach, and it's a way of understanding how, not just how intersecting oppressions inform people's lived experiences and their employment outcomes, but also enables us to look at the experiences of privilege as well. So the research I'm going to focus on today is predominantly looking at intersecting oppressions, but I have also done research looking at the intersecting privileges and disadvantages experienced by white male migrants. So that follows on quite nicely from Paul's talk as well. So the work I'm going to talk to you about today specifically looks at disability and gender, but understanding those as forms of oppression in the workplace. So thinking about these from the perspective of the experiences of disabled women, but also recognizing that disabled men may have different kinds of experiences to disabled women. So if we move on to the next slide, please. So why do we take this intersectional perspective? So as I'm sure you're aware, there's a growing impetus from governments to increase the rates of employment for disabled and neurodivergent people. So before I move on to that, I just wanted to start off with talking about how we conceptualize disability, because it's we take a particular approach using the social model of disability, which I'm sure that many people watching now are familiar with. So the social model of disability would argue that disability is a form of oppression that arises when somebody living with an impairment or a condition interacts with an environment that is not designed by or for people living with that condition. So, for example, through the social model of disability, we would say somebody who's autistic is not disabled by being autistic. Living and working in a world that's designed by and for non-autistic people is what's disabling. So I'm a disabled woman. I have hidden impairments. So a lot of my research is shaped by my own lived experience as well. And I can attest to Paul's argument. It can be very tiring asking people to recount their experiences. But it's very important that we do understand that if we're asking employers to take on more disabled and neurodivergent people, we have to understand that not all disabled and neurodivergent people's experiences will be the same. And by using the social model of disability, we move away from focusing on the individual, and we move away from individual adjustments towards an approach which looks at our working environments and identifies the barriers to inclusion. And those barriers could be the physical working environment, they could be policies and practices, and they can be attitudes. And what our research shows is one of the biggest barriers is the norms of an ideal worker. So who do we consider to be the ideal manager, the ideal architect, the ideal engineer, whatever sector you're working in? And quite often this is unspoken, it's not written down in policy anywhere, but these norms create a form of oppression, and that form of oppression for disabled people would be disability. When we bring it to an intersectional perspective, much of the research and policy tends to view disability in one area and gender in another area, or sex discrimination, as two separate issues. And so we see that the Equality Act sees protected characteristics, largely sees them as distinct. Now, the problem with that is the experiences of women are largely neglected in policy and research. So in terms of neurodiversity, we know that women find it much harder to access a quote-unquote diagnosis around neurodivergence. We know that conditions like autism have been traditionally framed through an extreme male brain hypothesis that came from Simon Baron-Cohen, and this then neglects the experiences of women, girls and women, and that neurodivergence may not present in the same way for girls and women as it does for men, which leads to women securing much later in life diagnoses. Alongside that, it's becoming harder and harder to access a diagnosis because services are being cut. So for many neurodivergent women, they don't know that they're neurodivergent, or they may suspect that they are, but they're not able to access the kind of support they may need, which is specifically for neurodivergent women. The research on disability and employment largely focuses on the experiences of disabled men, with the particular experiences of disabled women ignored. When we look at data that's collected at the national level, so we have surveys like the Labour Force Survey, but also a UK-wide survey called Understanding Society, these surveys do not ask anything about conditions which predominantly affect women. So they ask nothing about endometriosis, they ask nothing about heavy menstrual bleeding, and they don't ask anything about perimenopause or menopause, which isn't in itself disability, but it can be disabling in certain work contexts. So if the data that's collected doesn't even ask any questions about conditions which predominantly affect women, and other conditions women find it very hard to secure a diagnosis because they're seen as conditions which predominantly affect men, we can then see that women's experiences are largely absent from the evidence bases that are used by governments, stakeholders and employers to create policy. What our research has shown, I'm going to show you two examples on the next slide, is that actually disability is highly gendered, and the way that disability and gender interact in the workplace can have quite significant, very debilitating effects for women. So there's two studies here. I've put a QR code on the bottom right-hand screen for the report on the right-hand side. If you have any difficulties accessing any of this research, you'd like to read it, please do just get in touch. So I'm going to briefly talk to you about the first study, which was looking at the interactions between neurodiversity and gender in male-dominated occupations. So this was research that was funded by the Transport and Salaried Staff Association, which is a trade union that represents white-collar workers in the transport sector. And we were interested in terms of the experiences of women, not just who were neurodivergent, but were working in highly masculinized workplaces. And what our data showed, so we undertook a number of focus groups and interviews, was that for women in this sector, they were facing not only discrimination, sex-based discrimination, so being subject of kind of misogynistic jokes, being excluded in the workplace, not having access to kind of social networks that help to advance careers. They then also faced an additional layer of discrimination around neurodivergence. But their experiences of neurodivergent discrimination was not the same as men's experiences of neurodivergence. So what we were able to see is that women experience quite a complex interaction of disability discrimination and sex discrimination. But that doesn't mean that neurodivergent men necessarily experience a lot of privilege in the workplace. The limited wider literature suggests that disability can destabilize forms of dominant masculinity in the workplace. And what our research showed was quite similar. So one key example that really kind of sticks in my mind is the use of humor in the workplace. And I use the term humor quite loosely. The word that was used really was banter. And a lot of this banter was quite misogynistic and ableist banter with men who were neurodivergent, who may be open about their neurodivergence in the workplace, experiencing particular kinds of bullying in relation to being autistic. But what we also saw is that neurodivergent men were very reluctant to disclose neurodivergence in the workplace because they would need to seek help. That's how they saw it. They saw themselves as being vulnerable because of that, and that they would be seen as less than the ideal male worker in the transport sector. So what we argue here is that actually we can't understand employees' experiences of neurodiversity without recognizing those experiences are strongly gendered as well. And then last year we published this report, which was looking at the relationship between neurodiversity and menstrual health. So I'm sure everybody who's watching is very aware that there's a growing interest across the UK in issues around menstrual health, including endometriosis. But there's also going to be changes in the requirements of employers of more than 250 people to have menopause action plans. So this was part of a wider study looking at how can line managers better support women experiencing debilitating menstrual symptoms, so things like severe pain, fatigue, but also heavy menstrual bleeding. And what came through really strongly in our study is that neurodivergent women experienced a range of additional challenges that were not accounted for in policy on menstrual health or menopause, but equally they're not accounted for in policy and research on neurodiversity and disability. So the key quote that came to my mind when we were looking at the data is someone said, "It's been the absolute killer of my career." And by that, they meant being autistic and experiencing menopause. And if you think back to what I said earlier, that many women secure a later in life diagnosis, what our research tells us is that perimenopause is often the tipping point for women to seek out a diagnosis. They're unable to mask, so the term that many autistic people use for mimicking neurotypical behaviours in the workplace is masking. They lose that ability. Because of hormonal changes, they start to lose ability to regulate emotions, or at least that's how they perceive it. Now, on top of that, treatments for conditions like endometriosis may work differently for neurodivergent women, and medications for ADHD may interact with hormonal treatments for menstrual disorders. So neurodivergent people are between 15 and 20% of the population, so we're not talking about a very, very small minority. Alongside this, we undertook a smaller exploratory study looking at experiences of deaf women navigating menstrual health at work. And as far as we know, these are the first two studies looking specifically at the intersection between menstrual health, neurodiversity, and menstrual health and deafness. And what our research has shown is that many organisations are putting new schemes in place, for example, menopause cafes. But sign language interpreters are not being provided at these, which exclude deaf women, or that much of the work that's done doesn't take into account neurodivergence. And neurodivergent women withdraw from these kind of initiatives because they just don't feel that they fit in. What we also see is that at the perimenopause stage, many women, particularly neurodivergent women, exit the labour market. And I've got a PhD student, Gemma Gray, who's picking up that strand of research to understand what's happening to women in senior positions, because employers are losing very experienced, very knowledgeable women in their 40s and 50s, and it seems to be a particular issue for autistic women around menopause. The next slide, please. So what do we do about this? I think one way we can think about this is asking the other question: what happens if we don't account for intersectionality? So if we just carry on doing research and putting in policy and managing in ways that don't take into account intersectionality. And the first one is we lose the actual reality of people's experiences, of employees' experiences. We're hiding the nuanced working lives that people have. And why does that matter? So it matters because we may mask or hide existing inequalities, but actually what we also do is we create new forms of inequality in the workplace. We're losing a lot of time, so people are taking a lot of sick leave, they're changing employers, or they're exiting the labour market or going part-time because of a lack of tailored adjustments in the workplace. And picking up on Paul's point around sort of not viewing disability as a problem, I would see it slightly differently in the set. I'd say what we want to do is remove the emphasis on the individual to fit into harmful working practices, and that by taking an intersectional approach, we can identify those harmful working practices and what to do about them. So our policies and our practices need to be intersectional, otherwise we might actually be creating quite a lot of harm, which could lead not only to stress, exacerbated symptoms, but also poor financial performance for our businesses. Now, there's a final point here, and after this I will finish. Employment has to be seen as part of our wider societal landscape. Investment in women's health is very low. England has a women's health plan, Scotland does as well. Whether they're going to receive the kind of investment that's needed. But what we're seeing is employers increasingly filling gaps in healthcare provision. So, for example, providing access to a menopause specialist. But alongside that, there's a growing industry of training providers on neurodiversity and women's health. And sometimes these providers are not giving evidence-based solutions. They're training based off their own lived experience, which is important. But what we need to see is proper investment in women's healthcare. And I think we have to question whether this is an employer's job to fill this gap, and what the implications might be, for example, around issues of privacy. But we also need to have evidence-based interventions, and that evidence must be intersectional. Otherwise, the work that we're doing will fail. And I will end with that. Thanks very much.
Thank you very much, Professor Kate. That's a really, really amazing presentation, and thank you for being able to say all you said in that short time. I mean, on a broader scale, it's just saying, as leaders, as managers, as industry leaders, whatever initiative you're trying to push across, it's really important that we also consider other aspects of identity for it to be truly effective. And Kate, while you were delivering your presentation, and something I was thinking about, it means from a policy setting point of view, if you're involved in putting a process in place or shaping practice, it's important to ask key questions like, who is this going to be designed for? Whose experience does it center? And who might be excluded either by mistake or and this gives this wholesome approach to policy setting and makes the workplace even more inclusive. Thank you very much to you and to Paul, and thank you everyone for following so far. We've gotten to the point where we can now go over the Q&A segment. So I'll ask if you've been listening through and you've got anything you want to ask the speakers, if you can just pop it in the chat and then we can get to it. So, Kate and Paul, this is the part where we go over questions. We have some pre-submitted questions. We have one from Amelia, which says, how can we ensure engagement is intersectional? How can we work in an intersectional way without senior leadership buying? Kate, do you want to go with that one?
Yeah. So I do have a way of thinking about this. I suppose my first comment would be we don't have to assume that we can just let the senior leadership get away with not buying in. There are different ways that we can do that. I think intersectionality is actually a route to that because we all stand at intersections. And disability, for example, is one of the few protected characteristics, if we live long enough, that we will all be negatively affected by, if you like. So we'll all experience some form of ill health. We will all eventually become disabled. The route that we take in our research, so we do a lot of intervention research, is to really take an evidence-based approach and demonstrate to senior leaders around the evidence. Now, that evidence doesn't have to just be numerical, and I think there's a bit of a myth that everybody is kind of influenced by staff surveys with numbers on it. But actually, what we have found is presenting that lived experience, so having real-world examples is really important. And we've done a lot of training with senior leaders, and we can present the survey data and say X% of your workforce is thinking about quitting, but actually hearing from someone who has gone through that process and the effect it's had on them is a really effective way of bringing to life the issues that people are experiencing. The other approach we take is always co-design. So if we're helping an organization build policy, we take a co-design perspective, and that picks up on Paul's sort of earlier comment as well. And there's something in the disability literature that we talk about: you cannot be what you cannot see. Don't design for disabled and neurodivergent people, design with them. If only because you'll save yourself an awful lot of money if you make things accessible right from the very start. So Paul, you were talking about open plan offices. We generally say to people, try and avoid an open plan office if you can, because it's terrible for neurodivergent people, people with hearing impairments, deaf people, people with cognitive fatigue, etc. So one example I can think of about sort of physical working environment is in Scotland, it's now required for public places to provide menstrual products in the toilets. And they quite often don't put them in the wheelchair accessible toilets. And I have to point out that somebody could be a wheelchair user or need an accessible toilet and get periods. But if you're in a disability staff network, for example, you involve them in your policy creation, you have them give you feedback, you hopefully avoid some of that. And there's also very strong business cases actually for being intersectional. So if we look at the kind of experiences of women, which are often neglected, the reason actually I started looking at neurodivergence and menstrual health was really around speaking to large employers, particularly in engineering, who were saying, we're losing a lot of women in their 40s and I've got no idea, where do they keep going? Like, I've got an idea where they might be going, ask them. So they're then worried we've invested 10, 15, 20 years in training these people and they're leaving. So on a moral level, I try and avoid the business case, but it is also quite influential. And I also think show good examples as well. If you've got examples from other businesses or other sectors, or even from other parts of your own organization, as well as everything else I do, I'm a manager, and I try and sort of always think intersectionally and try and recognize, for example, that some of my PhD students are new to the UK, they're women of color living in a country that's totally different to their own experiences. And so in my own practice, I try and recognize that my experiences won't translate onto those people's experiences. So I try and kind of look up the evidence and also just speak to people in terms of what can I do to better support you. So yeah, in summary, I would say make sure you're coming with an evidence base and also embed co-design into the work that you're doing.
Thank you very much. Thank you very much, Kate. That's a really wonderful response. Paul, do you want to chip in there, or?
Yeah, so I would. I agree with everything as Kate said there. What I would overlay that with is story-based frameworks. So I think try and bring it to life as well. So if there's something you're looking for, frame it or put it into a story that it's easier for people to kind of understand. And if I look at the question, how can we ensure engagement is intersectional? Well, for me, the answer is almost in the question: engage. It's invite everyone to the table for a discussion. And I think if you're an associate, mid-level manager, or a senior manager, then you can tell those stories. You can engage in a number of different ways. Most firms will have regular staff meetings or town halls. Ask if you can speak at that to tell a story about your journey around intersectionality, whatever that might be. Ask if you can post something on the company intranet, because there's often that's something that can be used as well. So for me, it's about being raising awareness in a very kind of authentic way, and inviting a discussion that ultimately will influence those policies and procedures and policies and practices, to use the words that Kate referenced earlier.
Thank you, Paul. Yeah, I think that's really, really important, amplifying the stories of people, and also ensuring that leaders are co-designing with people involved, and not building for, but building with, having that collaborative approach to dealing with intersectionality. So we'll go to the next question from Mel. I think they're asking, how can intersectionality be upheld in a workforce against the tide of anti-refugee and anti-difference politics? Paul, you want to go first?
Yes, I mean, this sounds, as a question, this sounds, oh gosh, it sounds a bit scary. It's like, oh God, how do I approach this? How do I answer this in a way that feels sensitive? And I think that's what you've got to think about. It goes back to what I was just saying in answer to the previous question. You have to invite a conversation around it, initiate that discussion. Because if people are talking about it, hopefully that will dissipate concerns, will let it make it feel less scary. But I think to the points that Kate's been making, I think if you can find a way then overlaying that with evidence as well, you can tie the two together, and then it feels authentic, it feels considered, it feels correct, because you're combining the stories with the evidence.
Thanks, Paul. Kate, do you want to chip in there? Or?
Yeah, just very briefly, I think one thing we have to do is acknowledge the impact that these kind of politics are having on people. It's, there are real people behind the kind of the attacks that are happening, and it does have a very serious effect on people's, not just their working lives, but their lives in general, actually. And not as an employer, I remember several years ago, so I'm also a trade union rep, which probably doesn't come as a huge surprise, but after George Floyd was murdered, I wrote to all of our members to express my condolences. And I remember someone coming to me about a year later and saying, "You were the only person to say something." And we can't, I think that's a big part of it. We always think about kind of influencing up, but we also have to remember that we are leaders, and that people are looking to us for that kind of leadership. But I also agree with Paul that if we're in the position of doing EDI work, yes, there is a huge mental toll to it. I mean, there's no kind of deny to that, particularly in this kind of context, and it is very worrying. But to stay steady, and to build solidarity across organizations. So, we'll all be parts of supply chains. Can we embed it in the kind of the other organizations we work with? How do we build that solidarity across sectors? But also to keep to that evidence base, because no matter how much the anti-DEI people want to argue otherwise, there's real advantages to being an inclusive employer and an inclusive manager, and you will have increased productivity, you will have a much happier workforce, and you'll retain that workforce. So I think it's both acknowledging that this is real, people are harmed by it, but staying steady in the face of that and knowing that you are doing the right thing.
Thank you very much, Kate. I think one very, oh, sorry, Paul.
Yeah, I just wanted to pick up on that expression that Kate just used, stay steady. I love it. I think that really encapsulates what we need to be doing here. Is we've got those policies that have been created, or lots of companies have, around ED&I, and stay steady, because that really will translate into a happier workforce. They'll trust you if they see you're staying steady when you're dealing with these challenges. I think that's so important. I love that expression, Kate. If you don't mind, I'm gonna borrow that.
That's really nice. At this point, I know everyone's notes should be filled with key points. But one thing I found really consistent in what you have been saying, Kate, and Paul as well, is how as policymakers or as leaders in organizations, you need to kind of like prioritize evidence-based approach and not just assuming that and kind of like doing that in-depth assessment of the people you're creating these policies for and ensuring that it actually works for what it's supposed to do. So because of time, we're going to take two more questions. There's one from the live chat, Dubas. How do we support those with lived experience to share and co-create policy and guidance without overwhelming them? Kate, do you want to start with that? Yeah?
And we do a lot of this. So all of my work is co-designed. Again, I think it's by acknowledging that people are paying a price by helping you, because they are helping you in this kind of way. And I remember when I first started researching disability, one of the mistakes I made was interviewing people sometimes for an hour or 2 hours, and they're not really kind of thinking through the impact that was going to have them. They're going to be exhausted for the rest of the day. So sort of trying to be aware of the cost that there is to the individual. There are some practical things you can do though. So for example, in our work, we try and pay people when they take part in this kind of work. But if you're in an organization, we ask, can this be included in someone's workload for the year? So you acknowledge that they're part of the staff network, for example, and that may be part of promotion considerations as well, or when you're looking at pay rises. And making sure that, I think it's just really important to acknowledge that people are sharing their life experience with you, and they're doing so at some kind of cost, because you do make yourself quite vulnerable, when you tell people, particularly. So for example, if you're disabled, I've got hidden impairments, people might not know. What does it then say to people about me? What kind of assumptions will be made afterwards? But I think in terms of practical steps as managers, I would be saying, I always, with people I manage, say, well, you've joined the staff network on neurodiversity. I'm going to put that into your workload so that we know that you're doing it. It's not on top of your job. It becomes part of the job that you're doing.
Thank you very much. Paul, I'm going to ask you the next question from Oluola. It says, how can we as an organization embed and evidence neurodiversity in practice? I think that should be for Kate, but Paul, do you have anything to say to that first?
Yeah, look, I think a lot of the questions kind of they overlap in a lot of ways. So for me, it's about inviting people to the discussion. And I know this is me repeating myself, but we've already referenced that. But they need to be part of the discussion. There's an expression that I've used, I've heard others use, which is nothing about me without me, and that's so important that people feel part of the conversation. They also need to be heard. So if you're asking them the questions and they're giving you their views, to use Kate's word, they're making themselves vulnerable by sharing. You then need to be able to execute on some of them as well. You need to demonstrate that you've heard what they've said, and then you put that into the policy. So it becomes real, because if people feel as though they're being heard, they will likely engage more. They'll feel more confident. The safe space will become safer, and they'll be willing to give you more. And that ultimately becomes a win-win, because you're helping the workforce and you're helping the company, and ultimately again the investors as well, because there's always investors, company, and employees. Perhaps not in that order, but you've got that as the mix.
Thank you very much, Paul. Thank you very much, Professor Kate. Unfortunately, we're running out of time, and I would just want to say thank you to you both for such generous and honest responses. Your insights have been really, really amazing, and it gives us something to go back and reflect on, even as leaders, as senior managers, as junior managers, as policymakers, as industry leaders, and in our different contexts, to just kind of like think about how we can, shape DEI strategy in a way that favors everybody. Thank you very much for your time again, and thank you. So I think at this point we'll be closing, and just before we close, can I just ask for people who has joined online, if you just want to maybe just put in the chat your top 3 takeaways from this session. There's been a lot, I know. Just if you just want to pop that in the chat so everyone can, see how we can share ideas. I think for me, to sum everything up in summary, it's as leaders, as someone who is in charge of making these decisions, your first task is to listen. You should be someone who listen and play by the evidence-based approach, understand patterns before co-designing. Don't just go ahead and come up with something, because you can have a well-intentioned policy or initiative, but then again, it's not serving the people for which it's intended to serve. The good news, if you're trying to get really great at doing this, is the CMI has few certifications and structured pathways that you can benefit from. There's the Level 5 award in managing equality, diversity and inclusion, and that's designed for middle managers and operational leaders who want to understand the business case for EDI and lead inclusively in their teams. And we also have the Level 7 award in strategic approaches to equality, diversity, and inclusion. And that's tailored for senior leaders and executives who are shaping inclusive strategies at a systemic level. These programs actually provide the tools and, the knowledge required to, translate this from just mere theory into practice and anchor inclusion into everyday decision making. So I think the call to action from me to everybody who has joined this, before you put out a policy, take that time to ask, who is it designed for, whose experience does it center, and who might be inadvertently excluded from that policy. Thank you very much for joining. Now I'll hand over to Mary.
So perfect. So thank you for today's session. That's it. Thank you to our host, Kenneth, and to our speakers, Paul and Professor Kate, for your insight and expertise. Please stay tuned to hear more about CMI membership, and thank you for joining us.
Thank you.
Don't forget, as a CMI member, you can find the latest management and leadership insights at managers.org.uk. If you're not yet a member, join our community to discover CMI Confidence with on-demand resources, our network of mentors, and industry-leading accreditations.